When you talk about the team, Taki and Candy, how do you think about how that team should be assembled? Is it different to the inpatient care team? What kind of qualities do you look for when building that team?
At a high level, Chris, to some degree, I think nobody is perfect for home hospital care. Everybody has strengths and weaknesses. And so what you need to do is pull a team together that addresses those strengths and weaknesses. So for instance, on the physician side, we have home hospitalists who are geriatricians who are very comfortable with home-based care, geriatrics. They're used to taking care of very sick patients in skilled nursing facilities, but maybe they're a year or two away from their acute inpatient hospital medicine. And then on the flip side, we have hospitalists who are very comfortable with high acuity inpatient level of care, but they don't care for patients in the home. And perhaps they're not as used to the geriatric sort of risk tolerance and risk management in the home and sort of gray zones. And so I think if you bring folks who have skills from both sides together, and I think this is where it'd be fun to hear, Candy, your view on this. If you bring those folks together, and the most important thing is they have an attitude around creativity and getting things done for the patient. And I think our team has an amazing attitude around, we will do anything for the patient and family. We will figure out anything. That above and beyond is really what matters. Candy, I'd love to hear your view.
Oh, Taki, I couldn't agree with you more. Chris, we did build the team from scratch. Remember, this is a brand new program. And the positions were created and posted. We've started predominantly with quite skilled emergency department nurses. I actually was a bit surprised. I thought we'd get a few more applications from our inpatient colleagues. And I think as word of mouth goes out, I'm hopeful that we'll see some additional applications come in from the inpatient side. But we're really very fortunate that we have, incredibly skilled emergency department nurses that bring, a lot of amazing critical thinking skills. They're very comfortable setting up a quick rapport with patients and their family. That's, kind of what they've done for years. But to a person, they'll tell you that this is their first opportunity to give true nursing care that they were taught to give in school, because it's the most amazing holistic approach to care. So they, every day I say, are you still loving it? And they do. I will tell you though, we learned very early on the value of a case manager. We actually held off filling that position, I think because we bring that ED background, and although we work with case managers every day, we didn't fully appreciate the important role they play in this program. But you can't do it without a case manager. There are so many pieces in terms of knowing what agencies are out there, what elder services, for example, might provide, some other agencies to be able to get them financial, legal, hospice help, and the case manager brings that important piece to the puzzle. And just an incredible add because we had to figure out every day how to get those things done. But when we brought our case manager in, she knew just exactly how to reach out and get a lot of those services much quicker than we did.